watching CBS 2 News in high definition.
Every day, women are bombarded with images of what advertisers consider the ideal of beauty.
And thousands of products, creams, injectables, and even surgery are touted as ultimate weapons for anti-aging. But there is no one-size-fits-all approach as we look at skincare at every age.
Holly Clem is 23, Samantha Denisi, 36, Irina Constantine is 41, and Deborah Frank is 51. Though a generation apart, these women all share something in common. At every age, there is a specific consideration about skincare and the aging process.
As skin changes, we have to do things a little differently in order to maintain our best face.
One of Clem's concerns was knowing which products were best for her.
It's very confusing, actually, to be honest.
Generally, in the 20s, women and men should be looking at a good moisturizer and a sunscreen, and believe it or not, also a vitamin C serum at the minimum.
Clem's correct to address her concerns now. Doctors say it's easier to prevent than treat.
When people reach 30s, there's that psychological effect of all of a sudden being in your 30s. But from a physical standpoint, 30s is when you start to show the skin damage that you did when you were in your teens and 20s.
So a cornerstone of Denisi's regimen has been
sunscreen, and lots of sunscreen.
She says she uses a variety of products like peels and collagen boosters. Some of the changes she's seen in her 30s:
the pigmentation, the unevenness of the pigmentation. I'm noticing my foundation's going in places I've never really put it before.
But I think that the biggest complaint in my patients in their 30s are fine lines, wrinkles, deepening of these nasolabial lines, things that they never had before.
And so she's been getting Botox treatments as part of her approach to anti-aging. At 41, Constantine hasn't had Botox, but has used under-eye fillers.
I use products that brighten skin, that lighten the dark patches. I use prescription strength as well as over-the-counter.
But the question for many has been what products are best to use.
I think it's important to talk to your doctor about your skincare products, because if nothing else comes out of it, we're going to save you money. They're shocked when I tell them, don't spend that money anymore. Try this product. It's half the price, and it contains ingredients that have clinical evidence that work.
I'm not opposed to wrinkles per se, and I'm not opposed to the visible signs of a life well lived, but on the other hand, you do want to be the best that you can be.
Turning 50 for Frank meant a reevaluation.
I can't be in front of the mirror just layering 6 products: eyes, neck, forehead, cheeks.
She sticks to a simple regimen recommended by her doctor, along with Botox and injectables to smooth out her complexion.
For women in their 50s, it becomes more important to be a lot more interventional when it comes to their beauty regimen. I'm not worried, but I'm hoping that it continues to be delicate for me.
Me too. As far as product ingredients, doctors agree that over-the-counter and prescription-strength retinols are a key ingredient for a good skincare regimen, but they should not be used if you are pregnant or nursing. So, as always, consult your doctor first.
Me three.
Yeah, right? I think we'll all line up.